What's going on, guys? Dr. Choffner here, Doctor of Physical Therapy as well as Strength and Conditioning Specialist, and I'm helping you this month get rid of your hip impingement and pinching symptoms. Okay, so if you haven't seen it, go back and watch our first video in our series out of our 4. This will be our second video tonight. Our first video goes through the 2 types of different hip impingement you can have. Okay, number 1 is can, number 2 is pincer. So start with that, that's your foundation. That's where you're gonna learn how to diagnose if you truly have it through certain tests and different methods. And then if you do, kind of watch the whole series and then move on to the second video here. And in the second video, we're going to talk about the anatomy of hip impingement, how understanding your body can help you fix the pain once and for all for good. Okay, so really pay attention, get your notebook out, get your pen out. If you use your phone, get your notes app kind of up and running. All right, we're going to dive right in with that being said. So we want to understand how your hip socket is shaped, how the depth is, because this will better help you fix your impingement without making it worse in the long run. Okay, there are 3 things in detail we're going to talk about. The first one is a little bit of a tongue twister, supine knee to chest test. And for supine knee to chest at an angle test, that is the first thing we're going to dive into, probably the most important, so pay attention to that. Number 2 is hip joint position, all right, and then hip socket depth. Those are the 3 main things, and really it's just kind of naming anatomy in different ways. So pay attention. If you have questions, feel free to link them down below in the comments, and I'll be sure to get to them after this kind of posts. All right, so why are we talking about these 3 things? Why are we talking about this weird test? Why are we talking about hip joint position, and why does it matter? Why does hip socket depth matter? Because it's going to help tell you how you should squat in different positions that are more beneficial for you and your anatomy. If you do squat and you spend more time in these positions, you're going to have less discomfort, you're going to be able to lift more, you're going to be able to have better form while you do it. Okay, so this is really just understanding your anatomical limitations and where you should progress and where you should regress. Because all the time I go into these CrossFit boxes or gyms and I hear trainers and coaches screaming at people to kind of keep your feet straight, don't let them point out, or keep your trunk upright. When a lot of times people need to keep their feet pointed out in order to squat properly because of their hip anatomy, right? It just depends. So you should never judge someone based on just seeing them squat for the first time. You need to kind of learn about them, learn their anatomy, do these little kind of precursor tests too to get the most accurate and efficient results so they can get to their goals in a proper and efficient way as well. Okay, so number 1 is supine knee to chest stretch, or test we should say. It could be a stretch as well, versus the test at an angle. Okay, those are the only 2 differences and discrepancies here. So very simple. The way you're going to do this test, I do this all the time with people online, is you're going to have you lay flat on your back, either on the bed or the floor, whichever you prefer. It doesn't matter the surface. And you're going to take your knee with both hands while you're laying flat, and you're going to pull your knee straight up to the chest. Don't bring it in, don't bring it out. It's going to be straight up like this in this front plane. And if you can get all the way up to the top without feeling a pinching or a block sensation, that means that you have more of an anteverted hip, meaning it's more anterior or more forward facing. So that would mean your hip, that ball and socket joint, is a little more forward facing the wall in front of you. Okay, it's not better or worse than the other where it's more retroverted and backwards facing. It's just showing you that that's how your anatomy is based. It's the way you were born based on your parents and your genetics. The other one is if you pull the knee straight up to the chest and you get a block sensation where you can't really go much further than the hip where it stops you. And then what you do is you pull the knee out to the side a little bit, pull your foot more inwards, and you get a little more range of motion. It takes away that blocked or pinching sensation. That means you have more of a retroverted hip. That means your hip is more backwards facing the wall behind you. Okay, I personally have more of a retroverted hip, just the way I was born. It's how my parents are, it's how their grandparents are. So it tends to kind of follow a link down the chain, so to speak. All right, like I said, one's not better than the other. Now we're going to get into the details of what it means if it's more anteverted versus if it's more retroverted. Okay, so if your hip is more anteverted and you're able to pull it straight up without feeling that block sensation and it felt pretty normal to you, you probably like to walk with a more kind of neutral stance. So it might feel more comfortable for you to walk with your feet straight or even pigeon-toed like this, right? People tend to squat with more of a narrow stance and they can get a little more depth doing it that way. The minute they try and point their feet out, their squat goes to kind of crap, or it goes all over the place where their trunk collapses, they feel kind of weird and wonky. Okay, so that is anteverted. Retroverted is the opposite. So for me personally, if I'm retroverted, I like to turn my feet out quite a bit, not significantly like this, just out a little bit, like 45 degrees, almost like a sumo squat, and allows me to get deeper into it without feeling pinching in the front or sides of my hips. Okay, and then people who have retroverted hips tend to like or get benefit from walking with more of like a duck walk, like side to side, kind of like waddling in a way. Okay, so that's the big difference between those 2. That's hip joint position, which is number 2. Okay, anteverted, forward facing, pigeon-toed, right, versus retroverted, backwards facing, more of like duck walking. Okay, so that's super important because it's going to dictate how you should squat. Now, I'm not saying if you have retroverted hips, you should never squat with your feet straight, because you can do that too. I'm just saying it's going to take some practice, it's going to take some skill change to kind of get there. With appropriate coaching, you don't want to force yourself to a position that your hips don't feel good in either. So typically somewhere between here and here would be a safe point to start in. Okay, so that is hip joint position, the knee to chest test, and at an angle. And then the third thing is hip socket depth. So as we talk about hip socket depth, the way that works is if you can't bring your knee very close to your chest in either position, so you're trying to bring it straight up or you're trying to bring it out to the side and up, and you still hit a block with both positions, that means that you have a deep hip socket, okay? This is your hip socket, it's your acetabulum of your pelvis. This is your femoral head of your femur bone. This makes your hip joint. If you have a deep hip socket, that femoral head is very buried in that socket, okay, in the acetabulum. It's like this, so it's really covered. So that means that it's really hard for you to get into the extremes or the end ranges of motion of hip flexion where you pull that knee all the way up or out to the side, okay? If it's the opposite of that, if you can get pretty good motion in both positions without feeling a block sensation at all, right, and you have good range of motion, good mobility, no pinching, then that means you have a shallow hip socket, right? You're gonna probably have a little kind of easier time like doing gymnastics or like doing things in CrossFit that are super hard, doing splits, right? Any kind of thing that pushes you to the extremes of your ranges, okay? And a shallow socket is the opposite of this. A shallow socket would be that femoral head is a little bit further away, so there's a little more space and a little more room there, so it has a little more room to kind of function, meaning you're gonna have better mobility. But with better mobility comes a lack of stability, okay? So we'll notice that in a lot of gymnasts, or a lot of people who have really good flexibility, they tend to lack a lot of strength. Right? And that's the opposite for people who tend to have a lot of strength. They tend to lack a lot of mobility. It's very, very hard to have both. I'm not saying you can't have both, because you can. It just takes a lot of good skill, effort, and knowing exactly what to do so you don't waste your time kind of in and out of the gym. Okay, so guys, if you're going to be mad at anyone based on how your hips are after you do these tests, don't be mad at me. Get mad at your parents. It's based on your genetics, just the way it is, right? So be mad at your mom or your dad, because that's the way you were born, that's the way you came out of the womb, and that's the way, like, you can't technically change your anatomy, right? But you can do hip joint mobilization through a therapist can do them to you, or you can do them with a band. And those do help kind of reset the hip and kind of get you into more of like an anteverted or retroverted position. But sometimes it's temporary and it takes a while to kind of change that, okay? So thank you guys so much. Just to recap, we did supine knee to chest stretch at straight on and then at an angle, right? See if you're anteverted versus retroverted for your hip joint position. And then the third thing was hip socket depth. Are you more kind of a deep socket, or are you more of a shallow socket? All right, so go through those tests, categorize yourself being more forward or backward facing, and then being more kind of shallow or deep. And then let me know in the comments below. I'd love to hear, and I'd love to hear like how you feel when you're squatting, okay? So thank you so much for watching. We've had awesome feedback from our first video talking about the types of different hip impingement and how to kind of diagnose yourself with them through the test. So again, if you haven't seen that, go back and watch. This is our second video. If you understand your anatomy, how to squat properly, you're going to be less prone to having a hip impingement become a labral tear or become worse down the road, okay? So thank you so much again. Be sure to like and subscribe. Tune into our videos coming up. We have 2 more coming up for hip impingement. We're going to talk about actual treatment and exercises and band and mobilizations to do. So stay tuned, because that's where you're going to get the most bang for your buck out of those. And if you have questions, as always, link them down below. Thanks so much, guys. Take care.